Hello everyone, welcome back to our channel. This is Sujang at MDREX, and today's topic for me is about reimbursement guidelines for digital therapeutics in Korea. So here we go. After a short introduction about MDREX, who we are, I will go over with market access process for innovative medical devices and technology in Korea, and move to introduction to temporary reimbursement listing system for DTX products. And last but not least, case studies. So, who we are about MDREX. We, MDREX, are a Korean boutique medical device consulting firm, and our scope of work ranges from market research and strategy build-up for reimbursement, product approval, of course, KGMP, and the new health technology assessment, which is also well known as NHTA. We also support some clinical trials with collaboration with our partner CROs domestically and internationally. Sure, it is very important for you if you are a foreign manufacturer to have and designate a Korean marketing authorized holder who will act as a legal importer for you. And last but not least, we also cares and also supports distribution in Korea. So from now on, I will briefly introduce you and guide you to general market access procedure. So before diving into the procedural explanation, let me bring some definitions for your better understanding. So the first is new medical technology. What is new medical technology? It is defined as new technology that are different with existing technology, especially with its target, purpose, or method. The reason why we have such term is because we have existing technology lists already in reimbursement. But if there is something new with its target patients, target indications, or purpose of use, or how it works, the mechanism and method is different. When there is something new comes up, the NHTA, New Health Technology Assessment, comes in. Then it reviews safety and effectiveness of the technology. Then, what is innovative medical technology? Innovative medical technology is also something new, but it lacks in its effectiveness, not yet confirmed or well assessed. So we say that the technology, medical technology that is recognized for its safety and potential. So in short, it didn't properly prove its effectiveness yet, but it is recognized that it has potential for the future. So that's the innovative medical technology in Korea. Next is digital therapeutics. Most of you must have known about this, of course, but based on the definition of MFDS, which is Ministry of Food and Drug Safety in Korea, the governing body of medical device in Korea, defines the DTX as a SAMD, software as a medical device that provides evidence-based medical involvement in order to prevent, monitor, and treat medical disorder or diseases. It is used either to replace, supplement, or support drugs. So this is how it is defined in Korea. And there is a pathway for such technologies like new technology or innovative medical technologies. And here, what I brought up here is that is integrated review and assessment for innovative medical device. Remember I mentioned about the innovative medical technology. And here, the innovative medical device is the device that brings in with the innovative medical technology. So it is an assessment track that shortens the time significantly. I will go over with this more in detail for you later on, but just wanted you to know that there's such term in Korea. This is a chart we drafted to help you better understand the process when it comes to a new medical technology or medical device to be commercialized. For your information, we have several videos about the marketing and market access procedures and some more introductions uploaded on our MDREX YouTube channel. So just feel free to reach out. There are 3 languages in English and Korean and Japanese. So on the left side, you can see that it is a product-wide aspect, which is for the product approval and KGMP. The governing body is the Ministry of Food and Drug Safety. Under Medical Device Act, it reviews and evaluates one device's safety and efficacy. And together with KGMP certification and the product approval, it has to go for the technology-wide assessment, which is on the right side, blue. There are 3 parts, in major 3 parts, and the parties involved are HERA and NECA. First, the first one is about HERA stage. HERA is Health Insurance Review and Assessment Body. Under National Health Insurance Act, it determines first whether the technology applied is existing one or new one. It takes about a month, and if it is determined as existing technology, then there will be no longer assessment. It's just totally closed, and the technology applied falls for the current reimbursement price. But if it is determined as new technology, then the ball goes to NECA. NECA is National Evidence-Based Collaborating Agency under Medical Act. It conducts NHTA, which is New Health Technology Assessments. So it reviews the technology to see if the new technology is safe and effective. Here, to tackle NHTA, to pass the NHTA, there are several tracks that can be applied, which is about like deferred assessment or innovative medical technology track. And those should be also go back to the new medical technology assessment again, but still there are many tracks and pathways you can choose depending on your strategy. And when it is passed, the technology passed the new health technology assessment, it goes back again to HERA to show and to be assessed with its cost effectiveness and feasibility for the national reimbursement. It takes quite a long time. In the regulation, it says that it takes 30 days, but actually it takes 1 or 2 years. And the result comes in reimbursable or non-reimbursable or even selective reimbursable. I will stop here and then I will get through more in detail about the most important thing on today's topic, which is innovative medical technology, the integrated track. Like I explained in previous slide, there are quite many of steps to take to finally get through reimbursement listing. If a new medical technology, as I introduced, it gets through new technology assessments. For innovative medical technology, it gets assessed with its potential before new medical technology assessment. You can see the yellow part, the orange part, and required to generate real-world evidence to prove its effectiveness because it's not yet proven. The thing here is that the TTX we are talking about today is eligible for this integrated assessment as innovative medical technology. It significantly shortens assessment time from 390 days to 80 days only. Although this does not count MFDS review time for product approval, it is still efficient and takes much less time than traditional assessment procedure that requires an applicant and takes assessment time step by step. Here again, another thing to note is that there is a temporary listing step after clinical use approval. Once a medical technology passes integrated assessment, an approval for it to be used in a practical way in clinical practice is given. It's because it acknowledges its safety and potential, so it allows it to be generate real-world evidence during such period. And it is temporarily listed during the use period, listed into reimbursement system before new technology assessment. This is newly introduced by government recently, and I will continue to introduce about the temporary listing for you. So here, let me explain about the temporary reimbursement listing for the DTX products more in detail from now on. There has been discussion recently in Korea about how to assess and manage DTX products. And recently, finally, MOHW and HERA introduced guidelines about the procedures for assessment and reimbursement listing for DTX. This flowchart is one of the most important things introduced through the guidelines. Here, it demonstrates how it works in real world for reimbursing the price for the DTX product and how the patients and the medical institutions can get prescription to use. So first, in the middle, you can see the patients. When the patients visit the medical institution, the doctor or the physician or the healthcare professionals will see if the prescription of DTX is necessary or not. And if it is determined that it is necessary, then a code will be given to the patient. The patient will bring the code and enter after downloading the application. The application means the DTX product. And then the code, user data, and the information are transferred to the company so that it can submit those data to the HERA and also share the data with the medical institutions. The patient here, after getting the code, it make a payment to the medical institution directly, as much as it is supposed to. It's out of pocket expenses, and the ratio and the detailed price are determined later. But still, you make a payment to the medical institution, and the medical institution claims the reimbursement to the HERA. Then HERA will review the use data transferred from and submitted from the company and compare the claims made by the medical institutions. And it shares the result, the review result, with the National Health Insurance Service, the NHI, and then it makes payment to the medical institution. This is what the government introduced for the DTX use. Following up with the guidelines introduced last August, instruction to manage the temporary listing for DTX was additionally introduced in last December. Here, it gets more detail down to ground level, especially about how fee structure is and how to claim the reimbursement during temporary listing. You understood how the flow goes between the patient in medical institution and also manufacturer as well as the HERA. And this instruction is mostly about the fees and how to process the claims, the reimbursement claims. You can see that the reimbursement for DTX are eligible. It defines and it determines that it's eligible only when it is prescribed by physician for outpatients. And B, here you can see the fees, prescription fee is reimbursable only once for each product. And the C is evaluation fee because the DTX is for treating the patients and it requires data analysis as well to see if the use of the DTX was effective or not. The patient or the physician should be able to assess it. So it includes the evaluation fee. And this is also reimbursable when the patient's usability is confirmed and the treatment effect is evaluated. And finally, the actual fee to use the DTX is calculated in D at the end of the prescription and can be calculated additionally when re-prescribing if necessary. So during the period of use of DTX, no additional DTX with the same purpose are reimbursable. So this means during such period of time, only one purpose for one DTX can be reimbursed. This is what the government introduced in last year. So this is the summary chart for the fees that I explained in previous slide. So it states that all the DTX technologies on the top here and products will be reimbursed according to this structure. And there are two types of reimbursement that can be claimed: prescription and evaluation fee as reimbursable, and the TTX use fee for selective or non-reimbursable. Those two, prescription and evaluation fee, are related to the treatment by the healthcare professional and the actual reimbursement for the DTX products. But the treatment fee for prescription and the evaluation are determined like this. The price about $4 and $12. And the DTX use fee actually is determined by medical institutions because it's selective or non-reimbursable. Then let's look at the real cases in real world. Here, the DTX products the MFDS approved so far. There are only 4 DTX products in Korea approved. 2 of them, number 1 and number 2, are approved last year, and it is listed temporarily already last year as of 2023, December 26 in green. And following up with those 2, there were another number 3rd and 4th DTX appeared, and they also got approved last year or even this year. The first 2 technology, the digital therapeutics approved in Korea, are all about the cognitive behavior therapy for chronic insomnia use. You can see the details here, and what you can notice is that there is use period, which is from June 1st last year to May 31st in 2026. During this period of time, it must collect real-world evidence to present to NECA later on for NHTA. Because, remember that DTX are innovative medical technology that is determined safe, but lack of effectiveness. So it is recognized for its potential. So what can be done is that it collects real-world evidences to show and prove that it is effective. It shows effectiveness to the patient in real world. And the third, the DTX is narrowed vision, is about improvement for narrowed vision for patients with brain disorders. This DTX consists of this application and VR training for patients, you can see on the left side, and platform for healthcare professionals, so that the healthcare professionals can track and evaluate if it is working well for the patient. And the evaluation fee will be charged for that, as I mentioned. And so if the healthcare professional confirms or thinks that evaluates that this DTX prescription is not working well, it may try to change its way or frequency to use it, depending on the patient's situation. And the last case is called Easy Breathe. You can see on the left side, it also consists of the mobile application for patients and platform for healthcare professionals. Finally, the reimbursement, how the reimbursement was confirmed for those DTX. The first 2 DTX, as I mentioned, were listed temporarily reimbursable. And the use fee that can be either selective or non-reimbursable is determined. It can be determined by each medical institution upon application. So this means if one medical institution wants to prescribe this DTX to patients if they have the needs, then it has to apply to HERA or MOHW that claiming that they want to use this technology to the patients. And because it is temporarily listed, the medical institution can choose either selective reimbursement or non-reimbursement. But so far, no institution has chosen selective reimbursement type. So the fees is non-reimbursable at all. It's 100% patient payable. From our research, the total cost was ranged from 200,000 to 250,000 Korean won. And the thing is that it is almost half of the fee of the existing cognitive behavior treatment. Now, here is the conclusion and expectation that we have about the DTX future in Korea. So far I mentioned and explained about the system, the government itself got introduced. So the thing is that we need to see whether this model, this business model, put forward by the government can generate revenues for manufacturers actually in the real world. It will be the main point of concern. And the governing body is actually considering various monitoring models and method as well as compensation model. So this is the very first trial and the very first system introduced for the very new technology, which is DTX, digital therapeutics. So it will be very important to keep monitoring how the system works and how good or how bad it was and make an improvement in it. And following DTX products like the number 3rd and number 4th one would follow the same temporary reimbursement track to be commercialized. So we can expect that the 3rd and 4th ones and other like 5th or 6th ones will follow the exact same system with the prescription fee, evaluation fee, and the DTX use fee. It's up to the medical institutions if they want to have it reimbursable, the selective reimbursable or non-reimbursable. So let's see in the future how it works, and I hope we can have more discussions later on, and also hope that this video was helpful for you. If you have any questions or if you have any concerns about Korean medical device situation or any regulations, please feel free to reach out to us. Thank you.